Hi, welcome to today's presentation, and we will focus on the key challenges that will affecting the surgery rates and the patient flow at the Hipkins Hospital, and by Joseph Kelly and Scott Bukowski. Next slide. So in our bluff, we will address the challenges of improving surgery rates and reducing patient flow time at Hipkins Hospital. We recommend optimizing the staff utilization by hiring any additional EVS staff and flooring registrars and pooling surgeons and anesthesiologists for greater flexibility, and reducing variability in surgery times through standardized processes. And we also enhance the communication strategies that will improve the patient experience, and these interventions will reduce the flow time by 10 to 15%, an increase in surgical throughputs, and enhance patient satisfaction without the care quality or equity. Next slide, please. Before we dive into the solutions, let's first take a look at some of the key challenges that we are facing. Currently, our surgery rates are below potential. That means that we're not maximizing the capacity we have, and alongside that, we're seeing long patient flow times, which affects our overall patient satisfaction. These main factors contributing these issues are bottlenecks in patient registration, operating room turnover, and variability in surgery times. Addressing these bottlenecks is critical to improving our operation and providing better care to our patients. In the next slides, we will explore potential solutions to these challenges. Next slide. Analysis. In terms of optimizing staff, we'll recommend hiring additional EVS staff and the flooring registrars to address bottlenecks and help streamline operations during this peak periods. This utilization improvements, we align the staff shift timing with peak surgery times that will further improve efficiency. And for operating room utilization, we propose that investigating the current usage through simulation modeling, this will allow us to identify any idle periods and optimize scheduling to minimize downtime. By implementing these changes, we could increase the number of surgeries performed each day without the need to adding more operation room, and which maximize the use of current resources. Next slide. Analysis of pooling resources. Currently, each operating room has a dedicated team of surgeons and anesthesiologists that while this structure works, it limits flexibility and can create bottlenecks, especially during busy periods. We recommend pooling surgeons and anesthesiologists across all ORs, and which would allow for dynamic assignment. And this is based on demand. And this can change with reduce downtime as staff would be more easily to be available when needed, and ultimately increase our surgery capacity, which during our peak times, and without the need for any additional resources. And this approach will enhance efficiency and improves overall workflow. And Scott will take the next slide.
Thank you, Joseph. So, variability in surgery times is one of the most significant challenges to achieving operational efficiency in the surgical department. We often see that unpredictable durations for surgeries lead to cascading delays that affect not just the surgical team, but also postoperative care, nursing staff availability, and the overall patient flow. To address these inefficiencies, we can target variability reduction by implementing standardized processes and better planning. One effective way that we can reduce variability is through the standardization of preoperative and postoperative protocols. This includes using checklists for patient preparation, ensuring that the necessary resources, equipment, and team members are ready before surgery even begins. This proactive approach helps prevent delays that's caused by missing information, incomplete patient prep, or unavailable surgical instruments. In addition to preoperative checklists, standardized discharge or recovery protocols can further streamline patient flow. Another key recommendation is around optimizing the surgery schedule. Surgeries with highly predictable times should be scheduled earlier in the day. This reduces the likelihood of unexpected spillovers from complex or unpredictable cases that impact later surgeries. This approach will allow us to better use our resources like recovery rooms and nursing staff and create a more predictable workday for everyone that's involved. Ultimately, the goal here is to make the system more predictable, which not only increases throughput, but also reduces stress on our surgical teams and improves patient outcomes. So to summarize, we aim to reduce inefficiencies by focusing on variability reduction through processes that are standardized and scheduling optimization. These recommendations will help us improve the overall efficiency of our surgical department and enhance patient care. Moving on to the patient experience. Good communication is vital for enhancing the overall experience of patients and their families, especially in the context of surgical procedures where uncertainty can lead to increased anxiety and frustration. First, we're talking about perceived wait time. This is a very important concept because the perception of time plays a major role in patient satisfaction. Even if the actual wait time doesn't change, providing updates and information makes it feel shorter and more manageable. This is particularly crucial for patients who experience unexpected delays, such as having their surgeries postponed. These individuals often feel left in the dark, and that leads to dissatisfaction and anxiety. Our goal is to change that experience. We recommend real-time updates as a solution. Real-time updates can be delivered through various channels, whether it's a mobile app, texts, or even regular in-person updates from the hospital staff. Imagine the difference between a patient who's simply waiting without knowing what's happening and a patient who receives periodic information about their delay, the reason why, and a revised timeline. The second scenario makes the patient feel more informed and in control, which directly reduces their perceived stress. We should also consider support services for those whose surgeries are rescheduled. This includes personalized check-ins from staff, counseling, or even offering amenities that help patients and families feel more comfortable during their stay. The aim of this is to provide a level of care that goes beyond what's purely clinical. We want patients to feel that they are cared for holistically and as a person, which can significantly improve their overall experience. By managing patients' expectations effectively, we not only reduce dissatisfaction, but enhance trust. This leads to better outcomes as patients who are less anxious are more likely to have positive post-operative recovery experiences. Communication is key, and also makes the people feel like they are genuinely being cared for. The surgery workflow is best understood as a job shop process. This means that each patient is treated uniquely with an individual surgeries varying significantly based on their specific conditions. Unlike a batch or continuous process, the surgeries do not follow a standardized sequence or timing. Instead, each patient presents a different set of requirements, leading to significant customization in the workflow. This type of system, while flexible and patient-centered, presents challenges in terms of efficiency, as that it is harder to predict and standardize the time needed for each surgery. This can lead to variability and delays in the overall workflow, affecting the hospital's capacity to perform more surgeries each and every day. Currently, the flow time for surgeries at Hopkins Hospital is longer than desired, largely because of delays at various stages, including patient preparation, OR turnover, and variability in surgery durations. This variability often stems from patient-specific factors like BMI and other underlying health conditions. By making certain improvements, we can reduce the overall flow by 10 to 15%. Our strategies include pooling staff to create a more flexible resource pool, reducing variability in processes, improving scheduling to ensure that patients are prepared for promptly. By doing this, we could effectively fit in more surgeries within the standard hour workday, increasing throughput and improving patient care without sacrificing the quality of services that we provide. Bottlenecks in surgery. One of the primary bottlenecks occurs at the patient registration phase, where delays can push back the entire schedule. Another bottleneck is OR turnover, the time it takes to prepare the OR for the next patient. This process can be slowed by incomplete preparation or inefficient cleaning. That's where we recommend changes to be made. Lastly, there's significant variability in surgery duration. Patients who have a higher BMI or more complex history require longer surgery times, which can disrupt schedule for subsequent surgeries. Lastly, it's essential that the improvements that we implement prioritize diversity, equity, and inclusion. We must ensure that high-risk patients, such as those with high BMI or complex histories, are not deprioritized in favor of patients who are perceived as easier to treat. By focusing on efficiency rather than selecting patients based on ease of treatment, we can maintain a fair and just healthcare environment. So Hopkins Hospital has the opportunity to significantly enhance operational efficiency, increase surgery throughput, and improve patient satisfaction. By optimizing staff utilization, pooling key personnel, and reducing variance in surgery times, we can streamline patient flow and handle a higher volume of surgeries. By adopting these strategies, Hopkins can increase the number of surgeries completed per day, elevate patient satisfaction, and create a more efficient operational overflow. Thank you.